A new poll conducted by the Kaiser Family Foundation finds that support for Medicare for All among Americans has drastically increased. So prior to the release of this poll, it's been the case that we've seen a positive trend, and only over the course of the last couple of years have we seen some polls indicate majority support for Medicare for All. But with this poll, it shows that we've made significant progress. And I couldn't be happier about that. So when you look at the results here, now a strong majority of 59% support Medicare for All in the United States. And when you ask people if they want to keep a private option, with Medicare for All being an option for everyone, 75% favor this system. That is huge. 75% support a private option, meaning that they want everyone in the country to have access to Medicare for All, but if they want private insurance, then they can still keep private insurance or purchase private insurance. Now, they actually contend that this is support for a public option, but I would argue otherwise, because what they're really asking about is support for a private option, because this is what the question states. Do you favor or oppose having a national Medicare for All plan open to anyone who wants it, but people who currently have other coverage could keep what they have? That's a private option, because Medicare for All, if you have that, private insurance is no longer necessary. But they're saying, well, if you want to have Medicare for All, if you want nobody to be turned down if they don't have health insurance, but still allow people to keep their existing coverage if they want to pay for it, then that's what a private option is. So really, that's huge. Even if it's actually a public option that people support, 75%, that is huge. Now, other results show that 75% of registered Democrats and 58% of independents support Medicare for All, and now 36% of Republicans favor Medicare for All. That's more than a third of Republicans. So this is the result of progressive momentum. We have absolutely monopolized this debate. There's no question about it. We are moving discussion in this country about healthcare in our direction. We're saying Medicare for All is non-negotiable. We're telling people about Medicare for All, and we're not going to take no for an answer if lawmakers refuse to get behind Medicare for All, because we shouldn't live in a country as rich as ours where people die or go bankrupt if they don't have health insurance. It shouldn't happen. This change is the result of grassroots momentum. And what's really changing this discussion is, I think, a cultural shift when it comes to healthcare in this country, because we tried incrementalist reform, we tried Obamacare, and people were still going bankrupt and dying, even with Obamacare. People who supported Obamacare, myself included, who didn't think it was the end-all be-all, thought it was a step in the right direction, we were still dissatisfied because we wanted Medicare for All, and we didn't even get a public option. So now we're going to skip a public option and go straight for Medicare for All. No more half measures, no more incrementalism. We want Medicare for All because other countries have it and it works well. So I find this incredibly encouraging. Again, I feel a little bit conflicted, if I'm being honest, because I feel optimistic that this many people, 59%, that's the overwhelming majority now, support it, but it's frustrating that it took this long. And it's because we have a lot of forces working against us, not just the mainstream media, but the Democratic Party, because their health industry donors don't want them to support Medicare for All. But the more we call and encourage our representatives and senators to support Medicare for All, the more we continue to talk about this with our friends and family, the more we change culture. And if we want Medicare for All, there needs to be a culture shift. We have to make sure that we talk about this so people won't be susceptible to right-wing fear-mongering from Republicans. And it's not just Republicans. Dianne Feinstein said the same thing, that if Medicare for All constitutes a government takeover, she's not in favor of it. Well, look, we're changing the narrative. We're not going to accept this superficial fear-mongering. It's so stupid. It makes my head explode. Medicare for All can, and I think will one day be a reality in America, but only if we fight for it. If we start to back down, if we lose momentum, we're not going to get it. So we have to keep a sustained level of pressure. We have to be persistent in demanding that we will not take no for an answer. And certainly we can't vote for lawmakers or politicians who don't support Medicare for All. This is the ultimate litmus test. If you don't back Medicare for All, I don't back you. And if everybody takes this hardline stance on the left, we will actually change the Democratic Party. So, overall, this is great news.
Support this podcast by becoming a patron at patreon.com/Humanist Report.